and not just moving your eyes around in horizontal and vertical. You are limited to vertical eye movement. You cannot speak, you cannot move, you are tied to a wheelchair or bedridden. You are desperate to communicate with the people around you, but you have no way of doing so. This is an everyday reality for people with the locked-in syndrome. The locked-in syndrome is a neuropsychological syndrome where the person is quadriplegic and mute, but is completely conscious and completely aware of everything that is going on around them. And these are a few people with the LIS. My name is Maria Arias, and I will talk to you about the locked-in syndrome. I have done extensive research. I have looked at websites, articles, and a book called Ghost Boy, which I will talk to you about later. I will inform you about causes and diagnosis, treatments and recovery, and a personal victim story. Okay, causes and diagnosis. Unfortunately, the locked-in syndrome is difficult to diagnose, and it is usually misdiagnosed for the persistent vegetative state known as PVS. Has anyone heard of PVS? Someone being in a vegetable state. Well, the main difference between PVS and the locked-in syndrome is that patients of the PVS are in partial arousal, while people with the LIS are in complete awareness. Diagnoses include MRI movement tests and eye movement tests. This one is an example. They usually show you letters, images, or numbers, and they ask you to identify the object with your eyes. And that's how they know that you are actually aware. But unfortunately, this does not always work because some patients don't have gun control over their eyes yet. And an interesting fact is that 50% of patients with the LIS are actually diagnosed by family members rather than actual doctors, because when the family visits them, they realize that they are actually conscious. Some common causes include blood clots, hemorrhage, and stroke. You don't necessarily have to be born with it. You can encounter it later on throughout your life. Unfortunately, there is no cure or specific treatment, but there is supportive care to help you regain small movement or be able to communicate. Some of these include eye-coded communication, speech, and physical therapy. And complete recovery is very unusual, but you can restore some small movement. And I want to talk to you about a personal victim and his story. This right here on the far left is Martin. This was before he became ill. This is him with his siblings. At the age of 12, he became ill and he was hospitalized. He could not communicate with people for 13 years. And at the age of 16, he finally regained some conscious, but his family did not know that. He encountered a lot of hardships throughout his illness, most of it being with his mom. His mom became depressed and she even attempted to commit suicide. And Martin recalls his mother telling him that she wishes that he would just die. One of the people that was the main help in his recovery was his nurse, Verna, because she was actually the one that realized that he was actually conscious. And she took him to a university where they ran tests on him, and they introduced him to computer software. Through computer software, he was finally able to have his own voice. He was finally able to communicate with people, and he was very tech savvy, so his career is now a web designer. This is him with his dad when they would take him home. And this is him at TED Talks. I don't know if anyone has watched TED Talks, but to be on there is pretty accomplishing. And this is his wife, Joanna. He married her in 2009, and he met her through his sister. And now he is introducing his book, Ghost Boy, which he published in 2011. And it talks about his experience with having the disease, well, the condition, and it starts from when he was a child all the way through his adulthood. It's pretty interesting. I've read excerpts of it in my psychology class. I would definitely recommend it. And I just wanted to share with you a quote, some words of his. Have you ever seen one of those movies in which someone wakes up as a ghost, but they don't know that they've died? That's how it was as I realized people were looking through and around me. However much I tried to beg and plead, shout and scream, I couldn't make them notice me. My mind was trapped inside a useless body. My arms and legs weren't mine to control, and my voice was mute. I couldn't make a sign or a sound to let anyone know I'd become aware again. I was invisible, the ghost boy. And although Martin did not completely regain his movement, like I said, he was able to communicate through a computer, and with help of special technology and some regained movement in his arms, he can now drive a car and get around in his wheelchair by himself. In conclusion, I hope that I provided you guys with some new information and taught you something new. Although it's not very common, it does need to be correctly diagnosed to help the person as much as it can. Although there is no clinical cure, there are supportive treatments to help you regain some norms.